Hello again. Welcome to the Better Together podcast with Heritage Health. My name is Mike Baker. I'm your host. I think every week I just talk to you about how excited I am for the guests, so I'm not going to disappoint you this week. I'm so excited to have a conversation today with David Atkins and Kimberly Johnson. David Atkins is a provider here at Heritage Health. He's been involved in leadership and honestly just developing our behavioral health program over the last several years. We are at an incredible spot. We're going to talk about all of that. And so much of that work really is directly related to David and his heart for this work and really looking at behavioral health growing in our community. Kimberly Johnson is with him today as well. Kimberly is a provider at our Center for Healthy Living. Again, another incredible human. I think what you're going to hear in this episode is the heart that everybody has for the community and the people that we serve. So this episode, we're going to talk about what's happened in the last year at the Center for Healthy Living, what has happened within that process, the lives we've changed, and then kind of a future outlook on what healthcare or what behavioral health looks like going forward. So can't wait to have you here for this episode, and let's get to it. Hello, everyone. Welcome back to the Better Together podcast. I'm so excited, as we talked about in the introduction, to have David and Kimberly here with us. We're going to talk about all things Center for Healthy Living and all of the magic that's happened. So it's been really cool. So it's kind of a fun point of the year. So we have been in the Center for Healthy Living for just over a year now. We've talked about it several times already on the podcast. We've talked about the magic that happens there, the collaboration and all the great things that are happening. How's it been going? Do you guys have any cool, exciting stories about how Center for Healthy Living's changing lives and saving our community?
We do actually had one this morning. So I walk in the clinic getting ready to see patients, and one of our physicians from Post Falls starts texting me in the EHR saying, "This is the situation. I got this person here. They're in that window where they want to address their substance use. Are we taking referrals?" Like, that's the question. He didn't know. And it was great because in that same text, I was able to add Kimberly and just start the ball rolling right then. Because the question was not only do we take referrals, but how do we get them there? How do we transport them there? How do we do all of that? And Kimberly was able to hop in and basically say, how soon can they get here? So I don't know how it played
Absolutely.
out after that, but
Yeah, fresh, brand new example today. First thing this morning, 7:20 in the morning, right? Like David said, clients ready. Do you take referrals? Not only absolutely, but we have same day access. We can get him in today, this morning. How quick can he get here? And Dr. K was looking at how do we get him there? We might need a lift, reducing barriers. He came in, he got his assessment, got his recommendation, he's good to go. I mean, nothing better than that, right?
from the question of do you have referrals to patients, it was 40 minutes from start to finish. And so when you think of that traditional referral times, 3 months, 6 months, 9 months, pretty exciting. It's neat to see this work.
It's amazing. And that's what I was just going to get at for the follow up there. It's like how different that is from we've been having lots of success over the last several years with the behavioral health program. Just we've needed more providers. We've been able to increase the program, but I mean the difference between today and even 6 months ago. What a cool thing to have available for our community. And like, what does that mean? Like as a therapist, a provider at the Center for Healthy Living, what does that mean to you as somebody that's working there to have this resource available for you and your job and the people that you're serving?
It's the why. It's why we do it, honestly. And what better to reinforce I'm needed as a clinician and I'm helping But to have clinicians with full schedules, to have same day access folks coming in, I mean, it's 100% why we're here.
It's been great because from the medical provider side, medications are rarely the answer by themselves. So a lot of my job is convincing people they need to go see Kimberly or her team, and that's what's been. It's a lot easier to say, let me walk across the hallway and introduce you to your new therapist versus let me put in a referral and hope everything works out. And so being able to not only say, I can't fix your life with a pill, but let me introduce you to your new guide to get to that healthy spot. It's been life changing. And it really, I think, from a provider perspective, it's really how the system should work. But it's traditionally not how it works.
Yeah. But I think a lot of people don't know the story. I mean, that's one of the reasons we started the podcast was like, there are amazing things that happen in community health centers all across the country. And we have to be able to tell our stories and get them out there because it's so easy. Like if you just moved into the community and your kid's struggling with mental health issues or you're struggling yourself or whatever it is, a lot of times people just get lost. They don't know where to go. And if we're not telling our story, if we're not marketing, if we're not, outreaching to patients, that person's just going to feel lost. And I think one of the things that I love about Center for Healthy Living, it was just even in the design. So like we designed it to just look and feel different. You want to talk about that a little bit? How the environment itself has shaped some of the things that I like the provider office conversations.
I'll take that one. It doesn't feel like a doctor's office, and I think that's important. You walk in and you feel comfortable. I mean, from the very beginning. It also really it sets the tone that I guess stigma is always a big part of mental health, right? And so when you walk in there, you don't feel stigmatized because you are just there. There's no, oh, this is just the substance use part or this is just the psychiatry part. It's all in one place. So it really normalizes the experience of asking for help and getting help, which again is how it should be.
I love it. That's great.
I would agree. Coming in, one of my counterparts and I go for walks as much as we can every day. And when we come in, people welcome us just the same as clients. And what they'll say is, welcome, glad you're here. Are you checking in? Right? So it doesn't matter, like David said, if they're here for recovery services, therapy, psych appointments, welcome, are you checking in? It's a beautiful building, not going to lie. And to be honest, so it's a beautiful building, but clinicians and all the providers get to decorate offices, create their own space. So it's as unique as one of my colleagues has, butterflies and tie dye and purple everywhere in her office. Meanwhile, I try to keep the plants alive and kind of have a neutral environment, but it's also, welcoming for clients. But, those of us that spend hours and hours at work, it's home, it's comfortable.
No, it's such a cool story. I mean, you want to create this environment that's just comfortable and welcoming from somebody that's working in an organization to know. I mean, you're going to come in and you're going to spend your time. I mean, therap- therapists, people in the behavioral health space, people in helping professionals. I mean, we talked about this a little bit on last week's episode with Dr. Bate about how you're sharing your soul with so many people and like creating that space where you can recharge, you can be comfortable because you're talking about some really difficult things with people and helping people navigate some very difficult life situations. I think the environment is incredibly important. And we've talked about this in the past. Like behavioral health has always been where?
That's what I was going to say. Behavioral health oftentimes gets the leftover building. It gets the one that kind of smells like mildew or is in the basement or somewhere else. And having a building like this, I remember distinctly a patient coming in and she was brought to tears by it because she always felt marginalized in all aspects of her life, including her mental health care that she had been receiving. And just to get the respect and the tension and to really feel like Heritage sees her as a human being and giving her this space, it was pretty dramatic. It was moving to see that because, I mean, if we lived there, we didn't think about it as much, but her entire life had been, she felt second class, and she walks in a building like this where it's well thought out, it's welcoming, it's warm. It was a great experience because it really helped me realize the experience that she has had up to this point. So
That's great. So we have this amazing facility. We have incredible people working there. We've been working to address a lot of problems within the community. We're going to talk about same day access. So as a parent, if my kid was struggling in the past and I didn't know what to do, or if I was struggling, I kind of had a couple options. I could go to the crisis center, I could commit a crime and go to jail. But there weren't a lot of like same day immediate things. You could go to the emergency department. There were some things there, but honestly, that crisis level side of things has been challenging. So what I want to talk about sort of how we got to how we developed same day access, what that means. And I really want to tag in, Diana and like the crisis team into that. So let's walk us through like what were the steps that you had to take to get us to the spot where we can confidently say to the community, show up and we're going to take care of you.
Well, I guess I'll start and I'll
Mhm.
hand it to you if that's okay. So, great point, because back in the old days, we would get calls, an assessment would be scheduled weeks down the road. And by that point, like your kid or you or whoever is seeking help, by the time you actually get to that appointment, things have either gotten worse or you've just been like, forget it, I'm just going to figure it out on my own.
Mhm.
So, with same day access, for a lot of different reasons, we wanted to increase accessibility and increase helping clients when they're ready. A ton of work went into that, to be honest. I remember, teams meetings after teams meetings and trying to figure out how is this really going to work? You mean we have open hours and we're just waiting around for people? So it was a whole different
Mhm.
way of thinking and flipping it around to, yes, clinicians are ready and people come and they get help. And that's honestly as easy and as complicated as it is.
Right.
We have 8:30 to 10:30 Monday through Friday. You show up, we do some paperwork, you'll be seen. And at that point, like we were talking about the emergent, we can get you in, we can get you help, we'll get you going. By the time people walk out, they already have their next appointment. They know what they need to do and they know what we're going to do for them.
That's amazing.
And it was, I don't know, it was exciting along the process to recognize that we could do this because we've always known, like in that scenario you brought up, somebody needs help. What do you end up doing? You go to your primary care provider, you get a referral. 6 months later, you may be in with a therapist. That doesn't work. People need access right then.
Mhm.
But if you think of just a single counseling agency or maybe a few therapists there, there's no way they could do this. So we really had to get to a point where, blurring the lines between substance use treatment and mental health and growing that base of qualified, skilled therapists that could really take on anything that walks in the door. May not be the expert in that area, but they can do that assessment. They can start meeting people where they are and get them sent in the right direction. As the pieces kind of fell into place, when we realized we could do this, that was a pretty great experience. So
Yeah.
that was good. And part of it really was also recognizing that crisis happens. And maybe if you're in crisis, sitting with a counselor for an hour or two is not the right answer. Maybe there's another direction you need to go. And that was something we were able to add as part of this, is having several individuals who are skilled in crisis intervention come forward to just essentially be on call during all of our business hours, which has been fantastic. If somebody comes in, there is always someone available. If you're in crisis, you don't have to go to the ER and get forcibly admitted, which is what a lot of people are afraid of. If you go to the crisis center, you don't have to go there and be with a bunch of other people. You can meet one-on-one with a crisis specialist at Heritage, which, 2 years ago, that wasn't a thing.
Yeah.
So that's been an exciting addition to this, because people from all levels of, I guess, experience with the behavioral health field, but also all levels of concerns. I mean, it could just be, I'm feeling kind of down, I'd like to work with a counselor, so they show up. Or it could be, I'm seriously thinking about harming myself or someone else. We're the right answer in that whole spectrum,
Right.
which has been cool to see.
No, I mean, I think it's just all about that timing, like having the ability to get help when you need it. I mean, I think people get trained that I'm struggling, I go to get help, and then I'm not seen, or I'm told to come back 3 months later, whatever it is. I mean, that process, it's been hard, I think, for all of us in the healthcare system to just know that like we can do it better. What's the biggest surprise that's come from the provider side of this? Because it really did change the way that we had to think about structuring a provider day. What was the biggest surprise or takeaway from opening up and thinking about the process a little bit differently?
I think just the fact that we can do it and we are doing it and we're continuing every week. I mean, I do same day access every Mondays. It's We're always improving and we're doing it better.
I think a lot of it has been people kind of have their little niche they like to work in. So maybe they only work with kids or they only do substance use treatment. Recognizing that everybody, broaden those skills a little bit, and you may not be the end answer, but you can be a step in that path. And so that's really been the way I've been able to do it. It's all hands on deck. I mean, all therapists kind of work through the same day access process, and yeah, they do their assessment, they recognize where the needs are, and then can help direct whatever that next step may be.
So cool. So, all right. So we have a beautiful building. We've got staff. We have same day access. For somebody that has no idea what the Center for Healthy Living is and what services are available, walk us through like what is actually at Center for Healthy Living right now. What's a patient going to expect? What resources could they find today? And then we'll roll into what phase 2 looks like later. But
So when we moved into this building, we actually were able to consolidate 6 different sites within the community into one. And so when you walk in, you've got the front desk. They can direct you wherever you need to go. But as far as the actual services, there is neurobehavioral services, which is more of the testing, especially for developmental disabilities, learning disabilities, those sorts of things. So generally, that's the younger age, like, under 20. But the reality is those could have been undiagnosed as a kid. So adults as well. There's pediatric therapy, so mental health counseling for kids, families, adults. There's substance use treatment. There's co-occurring, which is where, you have a condition like depression and maybe an alcohol use disorder. And it's really hard to separate those, and you can't treat one without the other. So you can get all of those in the one location. There's also psychiatry. So that's medication management. There's diagnosing, but also just the medication management in terms of what meds are appropriate. A lot of people come in on a tremendous number of medications, and they want to get off of them. And that's one of the benefits of this is you get in with a good therapist, you start doing good work there, we can likely start getting you off of medications relatively quickly. And again, that partnership of being able to, if we share a client, we can just walk across the hallway and talk to each other. You get that wraparound experience. Did I miss anything?
Which happened yesterday, right?
It did happen yesterday, actually.
Yeah.
Yeah. So
that's great. Yeah, I mean, so having all those services together under one roof for patients. So, I mean, again, I think for us, the message over the next several years, to the community is just show up and we're going to take care of you. So, in the last episode, we talked about phase 2, which then, brings in medical, dental, pharmacy, our community space. What is that, just from a therapist provider side in the behavioral health space? What does that mean? What does that look like to have a medical clinic? Like all these medical patients. Our worlds have always been so divided in the healthcare system. You always have like the medical people, and then dentists are off in their own little world, and then behavioral health. But we're bringing everybody into one space. What does that mean to you guys, and what do you think that's going to look like?
We're better together, right? And the example from this morning, Dr. K's client that needed to come over to us, he wouldn't have needed a lift or a ride to come over. He would have been walked down the hall. So we're really looking forward to being all in one place, because wellness is so many things. And our clients struggle with a lot of things. Sometimes they do need psych and medication management, but one of the things neglected is usually medical. They don't know who their primary care is, even if they have one. So being able to establish that and vice versa.
it really will just allow us to be better at what we do as well. I mean, you really want to rule out the medical causes of a mental health concern before you start throwing medications at it or even doing therapy. Because if somebody comes in, they say they're super anxious, you can do all the therapy you want, you can do all the meds you want. It won't get there if the true problem is they've got AFib. And so they've got a heart flutter, they're feeling a little edgy, amped up because of that. You need to rule out the other causes, but this will allow us to work as a team. I remember in the past how many times when briefly psychiatry and dental were located in the same building, but patients would come in and their main concern for their mental health issues was tooth pain. And just the ability to walk them down. And I remember they would apologize, it's going to be a bit of a wait. And they're like, that's okay, how long? About half an hour. That's pretty exciting to go from, I went to psychiatry because I didn't know where else to go, but I can get you with dental in that short amount of time. And that's going to become an everyday thing. That's going to be every patient. I think of how many people will be able to come in, maybe grab a coffee or something at the juice bar, see their primary care provider, and maybe see their therapist on their way out, and just make a morning of being at Center for Healthy Living. And so that's a pretty
I mean, that's
that's
so
a pretty
cool.
cool future
People are
there.
like,
So
I'm just gonna go hang out at the Center for Healthy Living today, and work on my health. And I see that. I wanted to float into the groups because I think there's another magic piece about the group work that you guys are doing. But this whole thing about just bringing people together for a common issue, like our mission is to improve life. So that's a really easy thing to just rally around. And just like you said, imagine people coming to get a coffee at the coffee shop, and maybe they have a class at the workout space, or there's a cooking class going on, or they've got these group spaces to really process and work through things. um, I don't think a lot of people in the general public might know all about like the group therapy space and what that looks like. I play hockey at the ice rink across the street, and late at night I'm always seeing cars, like the parking lot's full, and then cars leaving. I- let's talk about that. Like what's happening at night at the
Everything.
Center for Healthy Living? It's like the new
The place to
hangout
be.
spot, right?
Absolutely. Wait till we get the coffee place going
Exactly.
there. Yeah, absolutely. So we do have a lot of groups. We have groups, honestly, in the morning. We have groups at night, like you said. We want to accommodate our folks that are working and get off at 5 or whatnot. So 6 to 9 p.m., Monday through Thursday, we have groups, like you said, to process, support our folks. Anything from DBT, learning skills, co-occurring, all sorts of great stuff is happening. The parking lots are full. We got a lot going on. But group work is really where not only are you learning skills, but you're also checking in, talking about challenges, successes, wins, and learning skills to be able to improve life. Groups are a lot. 6 to 9 p.m. My joke is we're going to make it, you guys. And it's so funny because my DBT group, my ladies, are always
Mhm.
like, it flew by. 3 hours has never gone by so quick. And I'm
Yeah,
like, flies when you're having DBT fun.
exactly. It's great.
I always like groups too when I'm involved with them. People look to people like me or Kimberly as the expert in the room on the groups, but the reality is the people that come, like the learning that happens when you put people with shared concerns, shared issues,
Hmm.
shared experiences together in a room. And I oftentimes just have to start the conversation, and then I learn from them along with everyone else. So it's
Yeah.
cool to see. It really is.
And again, I think that's what's missing in so many places in society, but especially in healthcare. I mean, you're alone, and you're struggling with all of these things. You go to the doctor, and then they say, "Hey, do X, Y, and Z," and then you go home and maybe you Google things, or now Chat GPT, how to build your health, whatever. But the human interactions that come, I think, from the group work, from the shared medical appointments. We talked with Dr. Bate last episode about working out together and learning how to eat together. I mean, there's just something about the human experience where it's just like most of the time, like that anytime you can be connected and working on something, I think it's special. It's been a really tough couple of years for our community. I'm so glad that we are able to be a resource. But like, what are the things that are coming up? Are there any common themes? Any things that are coming up in our community that someone that might be listening to, they may be having thoughts in their head that, yeah, I've had a couple dark days, but um, is that normal? Are people? Is there a lot going on? Is behavioral health issues and concerns, is that a little more prevalent than we think?
It's very prevalent and it's very much affecting everybody. I would say stress, anxiety, worry,
Hmm.
it's everywhere.
Yeah, I always joke with my patients, if you're not stressed, you're not paying attention. I mean, there's a
Yeah.
lot going on out there that impacts everybody, and just a lot of uncertainty, and feeling stressed, concerned, worried about that is completely normal. And I think that's what people get worried about. I always call it pathologizing normal, but it's being stressed, being worried is not you're not broken. Like that's how it is, and you're very much not alone. So that's where these groups come in, just to help understand I'm not alone. I've got a lot going on. I'm having trouble coping, and yeah, you're not alone with that.
Yeah,
So
that's great. Well, the healthcare system just keeps evolving. So I want to talk a little bit. So we know that we have legislators that listen to this podcast because I mean, why else? Like, what other podcasts would you listen to? But when we're talking about transforming the healthcare system, and the impact that behavioral health has had on this. We have a couple things that we've been doing in the past. So the ACT teams. Let's talk about a little bit about what an ACT team does and how that can improve life and help the healthcare system reduce costs. That's an important thing. And then just overall, like the impact of behavioral health on medical and how, again, it's improving life, but it's reducing costs, it's reducing stress on the system. So you want to tackle that? Maybe start with the ACT teams, and we can talk about like funding has shifted and things look different, but we can dream in this space.
Yes, yes. So ACT stands for Assertive Community Treatment, and it was really designed as a model to address people with severe persistent mental illness that historically would be institutionalized. So they would be, in a psych hospital for the duration of their lives. What the model allows them to do is live out in the community. They could be living in group homes. They could be living independently in an apartment or home. And the ACT team truly provides wraparound services. So it includes individual therapy, group therapy, psychiatric med management, case management, and then kind of the heart of the ACT team, which is the community-based workers. Those would be peer support specialists, skill builders. Those are probably the main two. But those are individuals who actually go out into the community and interact with the members of the ACT team, the patients, the clients, and help them live their best life, whatever it may be. We have one of our peer support specialists. I remember one of the main things he would do, he loved to teach people how to cook. And so somebody they just got out of the psych hospital. They're struggling with, they don't want to eat fast food. They know it's not good for them. They want to go somewhere else. And he would teach them how to make an egg. And they had never done that before.
Yeah.
So, here's the pot, here's the oil, here's the egg. And they had never done that before. And just helping these individuals who, have a lot of challenges figure out how to live their best life, whatever that may be. And those community-based positions really are, like I said, the heart of this because, meds are important, therapy is important, but really having somebody who's going to come alongside you, especially in the community, and live life and learn how to live life in some cases, that's invaluable. Peers in particular are the primary qualification for that position is lived life experience. So it's oftentimes people who have struggled with maybe substance use or mental health issues themselves, but they're on the road to recovery, they're in sustained recovery, and now they can connect with others who are trying to walk that same path. And if we're getting into funding, that's part of the struggle is that in October of last year, those positions were effectively defunded in Idaho. And so the concern that we have is as those positions go away, those are the people who are in the homes to say, are you taking your medications? Are you eating? Are you taking care of yourself? Is there substance use concerns? They're the eyes and ears in the community. And when those eyes and ears are gone, everything starts going downhill.
Yeah, what does that look like?
There's more hospitalizations, I guarantee that. We already, just due to overall funding restrictions, even before the funding was cut entirely, there were fewer touch points in the community. And I had patients that hadn't been hospitalized for years get hospitalized several times in the last year. And in most of their cases, it came down to are they taking their medications consistently? And just having somebody go in, paying them 15 minutes to go in, check in, and make sure the little med set is filled once a week and empty where it should be empty, that not happening, and people get hospitalized. And I got to tell you, it's more expensive. You could pay for one appointment that day versus a couple-week hospitalization, and the cost, short-term cost savings are so, I guess, out of balance with the cost to the system overall. One other, and then I'll let you speak too. But when you talk about the health impacts on this as well. The dietary side, that was one of the main things a community-based team works on is healthy eating. What do you have in your refrigerator? I remember one of our primary care providers was really struggling with a patient on the ACT team, could not get their A1C, their blood sugars down to even a remotely reasonable level. And she was talking to me about it. I talked to the skill builder that worked with her and went in, and the next day in the house, opened up a refrigerator. And there's nothing in there. What was she eating? And it turns out they were eating, like a pizza or two every day was their entire diet. And so started, going shopping with them. Again, how do you cook? How do you do this? And no other changes, no changes to medication, no other changes, just dietary changes. Diabetes, that A1C starts going down. It's all intertwined. Like you were saying, we really can't separate these things out, but there are downstream effects from losing these services.
Yeah, what's been your experience working with the peer support and case managers? I always think they're the heroes of the healthcare system. I know you've seen
Absolutely.
it. So,
Peers and recovery
yep.
coaches. I mean, the whole multidisciplinary team is amazing, but that lived experience that is different for the client to have somebody that can say, hey, I get it, I've been there. Clinicians are great, skill builders, absolutely, but that lived experience really pulls it all together. And we were talking about the cuts and the impact. I mean, really, it's pulled the rug out from under the things of what we know works. And it's just really hindering the client's ability to do what they need to do to be well. Without all of those services, hospitalizations are coming back up again. Without these critical services, people are suffering and going backwards, and that's really sad. We know it works, and we know that a multidisciplinary team and helping people be safe and healthy and stable in their home, in the community, is the way to go, not hospital out, hospital, and just that cycle continuing.
Yeah, when you think about the healthcare system, I mean, you want stability. I mean, you want to know that I'm going to have this predictable experience every single day, and especially people that are really struggling. Having someone walk a lot alongside them is a big deal. And like, if I'm a policymaker and I'm looking at like, how do I we get it, we do need to reduce the cost of the healthcare system, and sometimes these decisions, they don't feel like, you look at a spreadsheet and say, okay, well, if we cut this, that saves $1 million. I go, well, that's great. Well, if you cut the wrong thing, that actually like triples the expense on the other side of it. And so what we always hope is that as policymakers are thinking about these things, think about primary care, think about community health centers. Even, I mean, you go back to the Make America Healthy Again plan. I mean, community health centers are right in front of that. Like the primary care aspect of MAHA is right there. Affordable care where patients can access it, the right care, the right time, and honestly, at the right price. I mean, we can reduce the cost. And so that's a big deal. Um, at the end of the day, though, policy is all that, and that's the administrative side. But looking back at just the human side of this, um, what keeps you doing this? I mean, we talked about sort of the sharing the soul side of it, but why don't you each take a second and just talk about like, why do you do this? Because it's a hard job. There are other things you could do with your life, but as you said, it fills your bucket. But tell us a little bit about why you keep showing up.
Oh my gosh, I show up the teamwork, and that includes the folks I work with as well. But seeing the wins and the successes, kind of sharing in that I'm doing it, I'm doing better, I'm feeling good. I went to my psych appointment, I'm doing my groups. I really think, I mean, I'm human, I'm collaborative, and I'm social, and I love the dynamic of it's not just me. I wouldn't be in this field if it was just me. It's about the collaboration, the team, the folks I work with.
Now, you don't have to answer this if I'm asking the wrong question, but everybody struggles with something. I think sometimes people put providers on a pedestal. It's
Yeah.
pretty normal to be a provider and also have concern. Like, we worry about our families and kids. Is that true?
That's true, and that's normal, right? And that's one of the things. I mean, whether I'm, in supervision with an intern or one of the clinicians on the team or clients, nobody's perfect. We all can do better. We all can be more effective. And some of the skills I'm working on, I am open and honest. If any moment I could be in emotion mind, I need to try real hard to get to my factual, logical
Yeah.
mind, to get over to wise mind. And I think the more authentic we are as humans, and in whatever capacity, whether we're the CEO of a company or prescribing meds or clinician, we're all human. And I think that transparency is the thing that really affects the positive dynamics.
It makes it genuine, right?
Yeah.
Like, maybe today I have it together. Last night I didn't, and like, we're all struggling with things, and I want everybody to know that. I mean, just, you can show up. You're gonna find relatable human beings that are all going through this experience together. And yeah, we have some additional training. We have some resources. Maybe at the moment my life isn't in crisis, but we're gonna channel all of that energy into helping you have a better life. And I think, what a cool thing. But talk to us about. I mean, you've actually made some changes and gone back to doing a little more clinical work. Why do you keep showing up here, David?
Well, I mean, I'll start with some of the same answers. I mean, the team is a big part of it. You won't find better people than the people that work at a health center. I think there's a special kind of people that, I don't know, we show up because everyone else shows up too. So that's been good. Um, you mentioned, do providers, should we be on a pedestal? And I always say everybody's broken, but some people are better at hiding it than
Yeah.
others. And so we should be broken together, right? And that's really, I think, a lot of what drives me is being able to walk with people on this journey. When I was in school, I really thought I wanted to do inpatient, and quickly realized that's not what I'm looking for. I want to see the journey. The struggles are, there's meaning in that, but the successes, sometimes they seem far apart. But like this morning, saw one of my absolute favorite patients. He was probably the second patient I saw at Heritage, and he's done so well. He's 8 years sober from meth, and just got, I mean, the whole world he's out there helping people at this point. It's amazing to see. And I had a small part of that. And I think that's really what keeps it going, is if I can share some of myself, some of my expertise, and help people live whatever their best life may look like, that then goes beyond that. They're now helping people. They're running the AA meetings. They're the ones that, are helping their neighbor out who's looking to quit and whatever it may be. And you should go to Heritage Health. And so it kind of builds on itself. And you hear these stories in the community and realize that started with one conversation. That's, I don't know, it inspires me, keeps me going with that. But yeah,
Great. Well,
it's been good.
we are so lucky that you guys are here. I didn't talk to you about this ahead of time, but I thought it'd be fun to do here. We wouldn't be this organization without the people that came before us. So, I mean, we talk about Lidman Durney and the founders and all the work that happened. We recently had one of our really amazing providers retire. And I thought maybe we could just do a quick shout out to the amazing Gina Prindle. Let's talk a little bit about Gina's experience, because for those of you that don't know Gina, she's a long history working with health centers, but I refer to her as like the Swiss Army knife. She was just always interested in learning new things, and she started, doing medical, and then went into some behavioral health stuff. She ran her school-based clinic, and then retired doing some really cool things with the program. But let's talk about the Gina experience real quick, and then we'll work on wrapping it up.
Oh, Gina, I mean, you just dropping the bucket as far as her experience
Yeah.
there. I mean, she was in the military. She was a midwife, primary care. She came to me about 7 years ago and said, I want to kind of phase my career out in psychiatry. Are you willing to kind of mentor and coach me into this position? I thought, well, sure, we need another prescriber. Welcome aboard. And she said, I probably have 2 years before I retire. And she did just retire. So if we do the math, we got about 5 bonus years out of that. But no, it's neat to see. And I think community health centers draw people like that have such diverse experiences, because she did a school-based clinic, which is predominantly, I mean, she just said it was, sex ed. It was a lot of STD treating. I mean, it was primarily working with high schoolers and helping them navigate that difficult phase of life. She used her skill set to go so many different directions, including the residency, where she used her PhD in education to help develop curriculum, coach residents, really leave a legacy for the future, using all that vast experience to, impart wisdom into the next generation who will continue forward. So, yeah. Do you have any good Gina experiences?
I would just say, so client-wise, we would ask, who are you seeing? And when it was Gina Prindle, it was always positive. She listens to me. She's amazing. So, and that's the ripple effect, right? I mean,
Yep. Wow. Gina, thanks for all of your time. I know you're going to listen to this multiple times, but really, we're so grateful for all of the time that you shared with us, and just watching the impact you've had on the patients, the community, and the organization. We're incredibly grateful. So as we work on wrapping this up, I think the Gina thing's a really good segue, because there's lots of people looking out there. They're alone in their own little practice, or they might be working somewhere where maybe they're not getting the support, or they're looking for something different. You could have a Gina Prindle career, at a health center. What would you say to somebody that's, not quite fulfilled at their current employment, or if they're thinking about getting into the career? What would you share? What advice would you share with anyone out there like that?
I think, there's a lot of opportunities at a place like Heritage, because, well, what I always tell when I'm trying to recruit people in that are maybe on the outside is that nobody understands what you do except for someone else who does the same thing. And so using psychiatry as an example, if you're out there practicing by yourself, you may have a really difficult interaction and you just get to sit with it. There's not a great spot to process it. So when you're in a group practice, you're able to walk down, find an open door, have a seat, and they understand exactly what you're going through because that was their patient 2 hours ago. And so it's really to be able to have that level of mentorship, support, camaraderie is it's unique. And not only that, you then start looking into other specialties within the same field of, you can go talk to a social worker, you can go talk to a psychologist. You can't do that in most places. And so that would really, to me, that's one of the biggest selling points of really Heritage in particular, community health centers more broadly, but to have all those resources under one roof, but really the behavioral health assets that we have, I don't know of anywhere else. Like to have this vast array of behavioral health resources under one roof, so conveniently located, yeah, you should want to be a part of it.
I think so, right?
Absolutely.
Well, what do you have to share about on that side?
Well, I've told David this. I don't think I've told you this. I've been in the community in mental health since 2006. I was part of the smaller agencies here in town. Some are still around, some are not. I wish I would have jumped to Heritage far longer ago than I did. I came aboard in 2021. I would have, if I could do it again, I would have made that jump a long time ago. Like David was saying, and we were all talking about, clinicians are humans,
Right.
and we don't just want to do it on an island. Those folks that have private practices, that are by themselves, absolutely fine choice. But you'll have colleagues, you'll have camaraderie. You walk down the hall, you can staff, you can seek supervision, you can refer to other service lines in Center for Healthy Living, walking down the hall, other things that would be a benefit. So we have a full master's level intern program, clinicians, a lot of selling points. We really are a learning organization. I feel supported. We have monies every year that we get that clinicians use towards their CEUs. It's not just you do it on your own. It's really Heritage is investing in all of us, which is huge. It does not exist anywhere else. I can tell you, I've been there.
Yeah. No, I mean I think it's so cool, and I always go back and think, all right, would Lidwin and the founders, like, would they be proud of where we're at today? And I I had a moment. I think I talked about it early on one of the episodes, but I had a moment where I was before we opened. I was sitting in there, and I felt this like warm presence of just like, hey, you guys did this, and that just fills my heart with joy because I know that we're making a difference. And I want to say thank you so much for the time, the energy, the investment that you're making into our community. I mean, I've worked closely with David for many years. We've gone through so many different things and versions of this organization, and David he's just always there. He wants to see things get better. And when I've interacted with you and stuff, like just watching like you just have this genuine heart for everyone around you, and you want to lift people up, and like that makes all of our jobs so much easier. But that's the DNA of this organization. Like those are the right hearts to have, and we're so grateful, so lucky, and just thank you for being a part of it. So, is there anything else you guys want to cover before we wrap up here? And it's okay if not, but
I guess one thing that came to mind was just we're continuing to get better.
yeah, oh yeah, I
right?
wanted to talk
I
about it.
mean, we're not perfect, but we've improved from last year. Next year's going to be an even huge leaps and bounds with the things that are coming. So we're always improving. That's the good news. We're always learning and improving.
It's gonna be great. Lots of great things ahead.
Yep. I was going to say there's lots of change, but it's in a positive direction where I know at the Center for Healthy Living right now, we're looking forward to our new neighbors moving in here soon. So.
Great, and we'll have you guys back. Hopefully, we'll just have this annual, episode that we'll do. We'll do a state of the state on behavioral health. But yeah, thank you for being here. What a great episode. So, all right. Well, thank you for being here. What a wonderful conversation. I'm astounded every time I think about the resources that are available for people in our community. We're truly here to help. And, I think as you've heard, we've said it multiple times, we're not perfect, but we show up every day and we're trying to get better. And so if you're out there, if you need help, if you're looking for, help on with anything that you're dealing with, or if you want to find a career that is really rewarding, come check us out. And I think our message to everybody is just show up, come participate, come be a part of this. And we're gonna do everything we can to make this community stronger. So thank you for listening today. Be sure to follow and like and do all those great things so that more people get to hear about this podcast. And we can't wait to talk to you next week.